Well, my name is Sherry Cisneros. I am the Navigator Program Director here at California Bridge, and this is our Navigator Training Focus Series. We are honored to have you here today to learn about the next steps in advocacy. This is really what's going on in our communities, in our state, and national. So we have a very wonderful speaker that you know very well. She's our dear friend and biggest supporter at CA Bridge today. So I'm really excited that she's here with us. I'm spreading all of the wonderful work and all of her knowledge because she is an expert in policy. So especially for CA Bridge, she's done a lot. So I'll have her introduce herself in a second. I want to let you know that CA Bridge is a part of Bridge Center. We expanded, and several of you are already part of the other Bridge programs. We are also a part of Public Health Institute. They oversee our work as well as Department of Healthcare Services. So I think I acknowledged everybody attributed. So today we want to just make sure, and the biggest tip today is if you have a question, please address it to everyone. The little blue box on your Zoom says to panel or host. Please make sure it's to everyone so everybody gets to see, because they may have your same exact question. And if anything happens, we will follow up with an email. All right, good morning. Next. So CA Bridge, what is CA Bridge? Most of you guys know, but I always like to remind everybody our goal, you guys know our goal, you could do this for me. CA Bridge goal is for 24/7 access to high quality treatment of substance use disorders in all California hospitals. So that's what our goal, our value is everybody deserves access to MAT treatment, and we're just trying to grow throughout the state of California and take over the nation. We have national work as well. So before we get started, what is the CA Bridge model? For those of you that are new to CA Bridge, we are revolutionizing the system of care. We have a three-prong approach, with the first being low barrier treatment. That's our physicians and clinicians, nurse practitioners, PAs. We want, they're getting educated and trained to be champions to offer low barrier treatment. That means anybody can go into the emergency room 24/7 and request for MAT. And then the two other pillars that are most important are our navigators and our culture of harm reduction. We know our navigators, our community health workers, and our peer support specialists are doing an amazing, awesome job at handling these two: connection to care, navigating to treatment centers, inpatient, outpatient, wherever they need to go, and then making sure we are involving the patient for a culture of harm reduction, making sure they're safe and that they're getting unbiased and stigma-free care. So we thank you. We know you're doing a lot of hard work in helping patients, and as well as just bringing out awareness of stigma in the community. So we thank you. Next slide. Announcements. If you are, before we go to announcements, I really want to talk about opioid honor roll. I want to see if you're if your hospital takes part in the opioid honor roll. Let us know if they do, because we have an announcement that we wanted to share. So is your organization participating in the opioid honor roll? So I see a lot of people that are saying yes. So this is wonderful. So if you don't already know, they wanted us to make sure, and we're going to put their link in the chat. If you don't know what I'm talking about, we're going to put their information in the chat with the link right now. But it's a way to get designated at your hospital for kind of contributing the advancement of opioid either reduction in prescriptions, or by having a program like our MAT program in your hospital. So we wanted to announce that now it used to only be opioid use. They have expanded to all treatment, including alcohol use disorder. So it's no longer opioid, it's substance use disorder honor roll. So if you see that change, that is the reason. They want to make sure everybody is aware that they're expanding the scope of the honor roll. So it will include other things like alcohol. So this is a big advancement, just making sure that everyone who has substance use disorder gets the critical care that they need. All right, so Navigator update. We have a few events going on, so we always want you to be connected. So we have our app Navigator update with perfect timing. It's of April 9th on alcohol awareness. So again, if you're expanding, this is a good event to go to hear about what others are doing in their hospitals. The next is our Navigator Focus series. Next month, we'll be on best practices for educating SUD patients in the community. And I just want to let you know, I'm going to be recruiting for some of our navigators to give us some of their extraordinary stories about practicing educating patients in the community. And then if you haven't heard, our newest project is our CA Bridge Regional Collaboratives. These collaboratives, we've got off to a great start. If you were in the kickoff in March, then you know what these are about. We're trying to get all of the stakeholders and important people in the same room talking to each other. We know it's difficult to make those connections and networking with people in your own counties, your own treatment centers, FQHCs. So our regional collaboratives are a way to get people to come together to network and increase low barrier MAT treatment to patients. So we're happy to announce our next regional in-person is April 22nd. That's for Greater Sacramento, and more dates will be released as we head into the year. But right now we're focused on Greater Sacramento. These are the other regions. We hopefully will be coming to a region near you. If you have any information, need more information, please contact us at mentors@cabridge.org, and we will put some information in there as well to the link to register. So we're really excited, and we hope if you're in the Greater Sacramento area that we will see you. Speaking of regional collaboratives, we are in need. We still have 2 positions for a navigator mentor, and those areas are Northern Bay Area, which includes San Francisco, Alameda, Contra Costa. So if you're a navigator from one of those areas, please apply, as well as if you're from Southern Bay in Northern California, and that area includes Santa Clara, Santa Cruz, and San Mateo. So again, if you are interested in being a volunteer mentor for our regional collaboratives, we would love to have you. And I think Chaya is putting everything in the chat, so I thank her very much. So our objectives today are listed here. If you are interested in CEUs, these are the objectives, and please complete the post-event please read the post-event email. There is the evaluation, and if you complete the evaluation, you will receive CEUs for CCAP, CADAP, peer support specialist renewal, and CHW if you need those renewals as well. And now I'm very excited. Elizabeth has done a wonderful presentation for our navigators on California policy, the power of navigators to create change. And Elizabeth, how long have we worked together? Oh my gosh, it seems so long. I think almost 5 years.
Gosh, yeah,
So,
gosh. I guess I think, Sherry, I have a funny memory of meeting you at like the last training that we did before lockdown.
oh
So
yeah,
I think we've passed our 5-year anniversary of knowing each other, and then this fall would be 5 years of being co-program directors.
yeah.
So wow, it
Time
feels
flies
like it's
when
been 5 minutes and 5 lifetimes.
absolutely. And it's been amazing, Elizabeth, to have seen you just grow and develop your policy, your focus on policy. I mean, you always impress me with these updates of what you're doing in legislation. She, no need to brag, but she did get a bill passed. So I'm just, she is a wealth of knowledge, and I'm going to let her introduce, but thank you so much for supporting our navigators for all of the
Yeah.
5 years and being part of today's presentation.
My pleasure. Thank you so much for inviting me to give this talk, Sherry. Yes, we did pass a bill last year about access to treatment beds for chemical dependency recovery services, and hopefully that will be the first bill of many that we pass on behalf of patients with SUD. So my name is Elizabeth. I've met many of you, many familiar names in the chat. I also see some folks who are with us for the first time today. So I am the program director on the clinical side of California Bridge. So I oversee our clinical implementation leaders who are expert coaches available to give guidance on anything related to the clinical side of MAT. But as we know, clinical MAT would be nothing without navigators to support the patients after they do get that first dose or even that 10th or 100th dose. They'll continue to need the support of you. So today, I'm going to talk about the California policy landscape. This might feel, if you ever watched in elementary school that video, How a Bill Becomes a Law, about the US federal government system, this might feel a little bit familiar in terms of format. I wish I could have made a little cartoon video that would have maybe been a little more fun, but you'll just have to accept me here in my living room talking to you. And then I'm going to talk about 3 areas of California policy that are very important right now. So I know it would have been great to make a video, Rebecca. Maybe we can do that as a follow-up. So my goal today is that you feel really empowered to step into the role as an expert in patient care, because that is what you are. And if you take away nothing else from this presentation, nothing about the specific 3 areas, I want you to be very confident that you are the best person to tell your policymakers about what the patients in your community are experiencing. Without you, they don't know. So I'll talk about that a little bit more, but thank you for considering stepping into your power as experts in patient care. So policy is a little bit intimidating, right? I mean, that all plan letter that went out about the CHW benefit was 13 pages. And I think you needed not one, but at least 4 law degrees to understand what it said, when really all it said was you can now certify as a CHW and bill for services. So sometimes I think reasonable, intelligent people get a little bit intimidated by the policy space because there's a lot of jargon, a lot of legalese, a lot of process, but it's not that complicated. So next slide, please. Here's an overview of 2 of the 3 branches of the California government. We have the governor at the top, and the buck does stop with the governor. He does have the ability to sign or veto bills, and he does have to ultimately sign the budget, which determines where all of the money that California spends is going to go. The important thing I want you to know is that Governor Newsom is only governor for another year and a half. There will be a gubernatorial, that's a fancy word for saying governor, election next year in California, and this race is wide open. There are probably 7 or 8 prominent California politicians who are rumored to be thinking about running for governor. And as far as I've heard, and I did do some fact checking on this week in preparation for this talk, it's anybody's race. So Governor Newsom has been governor for quite a number of years. He has been in many ways an extraordinary supporter of expansion of MAT services. So I will be watching closely to see which candidates come to the forefront of the governor's race to think about researching what they have done about MAT expansion, what they know about harm reduction, just so that we know who we're going to be working with for at least the next 4 years. And I'm personally very excited that there's a very strong likelihood that these top contenders for governor might be a woman. So California, for all of its very well-earned progressive cred, has actually never had a woman governor. So I would love to see a woman at the top. We'll see. Then there are 2 houses of the state legislature. So there's the state senate and the state assembly. The committees I'm going to be talking about today are the health committees. Now, the health committees are really, really important. They oversee many, many different areas of state operations, but we all know that healthcare is at the forefront of many, many residents and many voters' minds. So the health committees are important, but what I want you to take away as I begin to talk about the actual policymakers is that on the assembly side, there are 23 committees, and on the Senate side, I'm sorry, on the Senate side, there are 23 committees, and on the assembly side, there are 32 committees. So as I encourage you to talk about reaching out to policymakers, what I really want you to understand is these folks on these committees, they are thinking about not only multiple things for this committee, but there's also 22 and 31 other committees overseeing many, many other issues as well. So policymakers' brains are really crowded. So that's why it's important to think about the most compelling stories and statistics that you can share. So let's see who is on the Assembly Health Committee. So we will send these slides out. You don't have to memorize this or take a screenshot. But if you are anywhere near any of these cities, I really encourage you to just know that you are really important. These folks on the Assembly Health Committee, they care a lot about supporting and passing policies that are going to help Californians who have healthcare needs. In this case, we're going to talk about SUD needs, but they really need to hear from you because they are the people who vote on issues that will then be put for a vote for the bigger legislature. So just to pull out a couple names here, Joaquin Arambula in Fresno has been a very strong supporter of California Bridge. He's helped us get a couple of important issues through the state house. Maggie Krell is actually a former lawyer for Planned Parenthood. She's a new member of the assembly, and I'm actually working with her office right now wearing my hat as the director of our reproductive health program, Access Bridge, writing a bill that would enforce the importance of emergency departments being able to respond to reproductive health emergencies. So let's take a look at who's on the Senate Health Committee. So a couple other names I want to pull out here. Caroline Menjivar represents Burbank and a portion of Riverside and San Bernardino County, and she has also been very, very supportive of bridge policies. We met with her office last year. And then one person I want to pull out is Weber Pearson is actually a medical doctor. So she knows the details, the ins and outs of MAT. She's done a site visit at one of our pediatric MAT programs in San Diego. So definitely it's always worth taking a look at this, thinking about whether you are in the district of one of these health committee members and thinking about doing outreach. So you're probably thinking, Elizabeth, there's a name on this list and I live right in their city. I would, what am I supposed to talk to them about? Do I just call and say, I'm a navigator and I have some thoughts? Basically, yes, that is exactly what we want you to do. So some ideas to think about when you contact your legislature. You can talk about your program. Say, hi, I'm a navigator at such and such hospital or such and such community-based organization. We've been running a program for this number of years that supports patients to access ongoing treatment after they begin buprenorphine, or you can just call it medication for addiction treatment if that term might be more known to policymakers. And then say, I'd like to tell you about the success my program has had and how the state could support expanding it. Or I'd like to invite you to visit my hospital to see how we actually navigate patients from an emergency department visit to ongoing linkage to treatment. Another thing you might do is ask for support for a specific bill. So there are a couple of SUD related bills going before the legislature this year. We can share out information. Last year, when we passed the bill about beds for chemical dependency recovery center services, we did have some people call members of the committee to give them information about that bill and say, this bill would really support me in improving my patient care. Please vote yes. You also might advocate for or against a pending change. So you all have likely heard that we are expecting to have cuts to Medi-Cal in the budget that's going to be passed in June. So now is a great time to start calling your policymakers and saying, I'm aware that Medi-Cal cuts might be coming, and I'd like to implore the assembly person or the Senate member to vote no against any pending Medi-Cal cuts. So how do you reach these people? Well, we have a evergreen guide at California Bridge. We will send this out. You also can use the QR code, and it gives you a step-by-step guide. You put in the address and zip code, and then it will give you the contact information for the office. And there are staff people who work at these offices who are always looking for people in the community with relevant roles to connect with. So I would say that the likelihood, if you go through the step-by-step guide and actually contact your policymakers, they will almost for sure actually want to talk to you. I obviously can't guarantee it. Could be a busy day for them, but this is definitely something that you should consider doing. Chaya just dropped it in the chat. I would recommend, it might be interesting for you to put in both your home address where you live and your hospital address. And if you're like Elizabeth, I live 5 minutes from the hospital. Trust me, the way that the districts are created makes very little sense. And if you look at a district map of California, it looks like a jigsaw puzzle that is related to some political considerations that we can definitely talk about another time. But even if you live really close to your hospital, there's a really strong chance that you maybe live and work in different districts. So it's worth looking at, and then you can actually call both. You can say, you know, I live in your district as a constituent, or I work in your district as somebody in the hospital in your district. And my experience talking to multiple staffers is that they do have a really good idea of which hospitals are in their district, and they might have some level of awareness of which ones are friendlier to patients who are relying on the safety net. So definitely, I will defer to you as to whether to reach out to the district that your hospital is in or the district that you live in, but both are good and they might be different. So something to think about. So what is going on in California? A lot, all of the time. There are 38 million people in this state, and there are, I think, 482 separate cities. So 38 million people, 58 counties, and 482 incorporated cities and towns. So that's a lot of potential areas of interest and topics that could affect people. So we're going to talk about 3 today, and I'm happy to have you ask any questions that you want to know about these topics in the chat, and I will do my very best. And I reserve the right to say I don't know, I need to look it up, because if I don't know, I would love to look it up for you. So first, we're going to talk about the opioid settlement funds. So I'm curious, and you can just tell me in the chat, maybe I'm alone in this experience, but how many of you have heard someone say, what about those opioid settlement funds? Can't those just fund navigator positions? Can't those just pay for MAT programs? What is the point of the opioid settlement funds if not to reduce the harms caused by the influx of prescription opioids into the prescription drug supply throughout the 2000s and 2010s? We would love it if the answer to that was an obvious yes. So the opioid settlement funds are very large pots of money in the tens, if not hundreds at this point, of millions of dollars that have been that judges have required pharmaceutical companies to make available to make up for the harms that were caused by producing way more opioids into the market than patients realistically needed or were safe to prescribe for medical care. So those funds have been passed down to the state, and then California, what this slide is showing you, California took an approach where 15% is allocated to the state, 70% is allocated to those 482 cities and counties, and 15% is to a smaller subset of cities and counties that actually had more to do with bringing the lawsuits in the first place. So the big number here is the 70%. The way California distributed the 70% is that they split it up by county and sent the funds to the county. There was not a lot of information about who was receiving those funds or what the counties were supposed to do with it. They did receive, I think it was a 12-page letter on approved remediation activities, of which ED-based substance use navigation was one of those activities. But it's been quite challenging to locate exactly where these funds have gone. However, we know a lot more than we did when these monies first got sent to the local municipalities. So back in I believe 22, Aiden, you can check my work on that. It might have been 2023. We did compile some guidance intended for navigators and champions who might want to figure out where these opioid settlement funds have gone. And these are still really good tips. I actually looked at these. I probably hadn't looked at these tips in a year and a half, and I looked at them thinking, oh, surely we would want to update them, or maybe one of them wouldn't be a good tip anymore. And these are really good tips. So, some things you can do: get involved with your county overdose prevention coalition. Many of those overdose prevention organizations have received funds or have been very involved in tracking where the funds are going. Continue to tell stories about your patients and about how the data you collect about your patients are improving hospital quality metrics and decreasing length of stay, decreasing retention. California Bridge has an exhaustive suite of resources to help you tell those stories and collect that data. Latoya, Chaya, and Sherry would love to talk to you about them. We also have past recordings about those resources, but really important to continue to document the impact of the program so that when the time comes to receive some of these opioid settlement funds, you'll know exactly the impact you can tell people that you will see. And then there also are some great pieces of data, like this study that's linked in the slide, that shows that patients who do meet with a navigator after their ED visit have a triple the likelihood of staying in treatment. So these are just really good things to do so that when the opportunity does come to be eligible for some of these settlement funds that have been sent to your city and county, you will know where they went. Tanya is making a great point in the chat. I feel very cynical about this point, but Tanya, you are 110% correct. A lot of this money went to law enforcement. So that is something you might find when you go sniffing around the opioid settlement funds. You might find that a lot of the money did go to law enforcement. We hope that law enforcement in turn will use the funds that they receive to do things like have lots of Narcan available and think about engaging non-law enforcement workers in their outreach efforts. So we can only continue to kindly work with our law enforcement friends to encourage that kind of behavior. But you're completely right, Tanya. So here's an idea of the money that we're talking about. So I'm showing you this slide. This is just a screenshot from an organization called Kaiser Health News, so KFF Health, and that is the same Kaiser as Kaiser Permanente, but a completely different organization. So Kaiser Health News does not have an affiliation with Kaiser Permanente, for those of you who are wondering. So the journalists at Kaiser Health News have done some truly heroic work to track where the funds are going. So this is just a screenshot. This is a random screenshot. I did not select these counties for any particular reason. But it shows you the actual amount of money that is still on the table. So as you can see, Riverside County has received $15 million. Not a small amount of money, but over the next 13 years, it's going to receive $68 million. So again, you can read these numbers, but the point that I want you to take away from this slide is that there is a lot of money on the table. So definitely, we encourage you to consider taking some of these steps to locate your settlement funds, figure out who the decision makers are, and advocate for support. Here's another way to figure out what's going on in your county. So through the link that was on the previous slide that we will send out, you can actually sort where funds have, what reports have been documented of funding that has been spent by county. So this is just an example. If you look at the fourth row here, Alameda County, you can see that some of the settlement funds went toward a project at Santa Rita Jail to improve services for patients who are clients of the jail. And, this is actually a really interesting one because California Bridge actually today is doing a site visit at the jail to see if they can help improve patient signage so patients understand their right to MAT and how they can access it. So I really encourage you to go on the KFF website and click around, see if there are any documented projects in your county. And it's pretty likely, since you all are so looped in to your local services, that you might see somebody that you know might be getting some funds in your county or from a local community-based organization. You might be able to call them up and say, I see that you got funds for this project. Has it started yet? What's its process? How can we work together to make sure that these funds are put toward evidence-based care? All right, so this is probably the least fun topic. We love money. The settlement funds are about money. This is the opposite of loving money, is that we are unfortunately expecting there to be cuts to Medi-Cal services when the budget is passed in June or early July. So why are there going to be funding cuts? The reason we are expecting funding cuts is that you may be aware that the federal government is making tremendous cuts every possible corner of the government that they can. So we are nonpartisan here at California Bridge. I will reserve my own opinions about the behavior that's going on at the federal government, but one of the reasons it's kind of easy for me to reserve that judgment is that the outcome is going to be the same. So we are expecting that there will not be as much money coming to the state of California for Medi-Cal as there have been in past years. So your next question might be, Elizabeth, isn't Medi-Cal a state program? Why does it even get federal funding from the government? So Medi-Cal is made up of both state funding and a match from the federal government. And the Medi-Cal budget is about $170 billion. $161 billion of that does actually come from federal funding. So really significant amount of federal funds actually go to pay for Medi-Cal, even though it is administered by our friends, the Department of Healthcare Services, DHCS. So there are some estimates. This slide, please accept this slide as rumor. This is a rumor. Nothing has happened yet. There have not been any detailed plans for Medi-Cal cuts that have been released publicly. So we do not know exactly what these cuts are going to look like. We will not know until probably July. We do expect that they could be as high as $20 billion. So that's about an eighth of the current budget, which is really significant. I mean, think 1 in every 8 patients you see, right? That's real cuts to the budget. Some organizations and stakeholders that could be impacted by Medi-Cal cuts include care for undocumented Californians. So right now, undocumented Californians are able to get Medi-Cal, and we are worried that with Medi-Cal cuts coming down the pipe, that might be a benefit that the state chooses to cut. So just know that your undocumented patients could be at risk if Medi-Cal cuts are coming. The other group that I really want you to know about here is clinics that rely primarily on Medi-Cal funding. Clinics that take only Medi-Cal patients, FQHCs that have special financial arrangements for Medi-Cal patients. These clinics, as many of you know because you visited them and you've sent patients to them, they already operate on shoestring budgets, on, bare minimums of staffing. So we are very concerned at California Bridge for what Medi-Cal cuts could mean to our clinic friends who are helping patients stay in treatment. There's also a chance that the state could make the choice to do fewer direct service for healthcare cuts and more cuts to the social safety net. So those are all the myriad of services that you help patients access, such as CalFresh, transportation subsidies, anything else that you help patients do to reduce chaos in their life by drawing upon the social safety net could be at risk. So know that that is potentially coming, and we are working hard at California Bridge to stay very on top of this so that when we know something for sure, we're able to both communicate it to you in a true and non-rumor fashion, and also so that you know what you can do to help patients who might be impacted by these cuts. And there are a few things you can do today to help patients. So one of the things you could do is if you have a patient who you believe has an SUD that is severe enough that they would qualify for permanent disability, they actually might be eligible for Medicare cuts. And now Medicare is not necessarily completely off the chopping block for cuts, but surely if a patient has access to both Medi-Cal and Medicare coverage, they will be in a better position than if they're just receiving Medi-Cal services, even though they could qualify for a permanent disability and get SSDI insurance and get Medicare. So your hospital social workers should be able to help patients navigate that process if you do have a patient who you think has an SUD that rises to the level of being a permanent disability. Some other things you can do are to support patients to give them access to long-acting treatment that might minimize disruptions in their treatment should there be short or long-term cuts to their coverage or to their services. So we love long-acting injectables as an option for MAT at California Bridge. And if you have providers who are hesitant to offer long-acting injectables because there's extra pharmacy steps and maybe they just haven't gotten the clinical education that they need, please reach out to me. We actually are doing a ton of clinical education right now on long-acting injectables, so I would love to include any of your providers in the fold who might be interested in expanding this service for patients who are going to be at risk should there be cuts. The other thing you can do, and again, I'm gonna be a broken record to Sherry and Latoya and Chaya here, bill for CHW. So if anybody is on this chat and has not become a certified community health worker through California Bridge, run, do not walk after this meeting to do that certification. The community health worker benefit is a new benefit. It only has been required for managed care plans to pay for a couple weeks. Now, we do not have any information that a newer benefit is any more likely to be at risk than a benefit that's been around forever. But at some point, the state may choose to look and see which benefits are highly utilized and which benefits are lesser utilized, just as a decision-making tool. So you have to start billing. Start billing so that we can continue to prove that these services are essential and are improving patient care in real time. So any questions about billing, Chaya and Latoya are standing by, ready to help you start billing. So Henry, that's a really good question about a list of California pharmacies providing long-acting injectables. I do not have a list, but I do have a pretty thorough network of providers who are offering this care. So if you reach out to me and tell me where you are, or even you can just put in the chat, tell me where you are, I can help you find a pharmacy that's going to work with you on long-acting injectables. We can definitely do that. We've been doing a lot of work on that on my side of the shop right now. So just either share in the chat or reach out to me after this. All right, I've got one more topic for you, and then I want you all to be ready to be excited about talking to policymakers about these cuts or about these topics, hopefully not cuts. All right, this is the last thing that I'm going to talk about today, and this is SB 43. So SB 43 is a bill that was passed a couple of years ago that was intended to increase patients' access to treatment, to involuntary treatment. So what SB 43 does is it expands the definition of grave disability to include severe substance use disorder or co-occurring mental health and substance use disorder. So in terms that you'll understand if you work at a hospital, this makes it easier for hospital staff and providers to decide to place a patient on a 5150. So it reduces the likelihood of patients being able to leave AMA, and it also lifts the bar for counties and communities to have treatment beds available for patients. So this might sound kind of obvious, but if you are placing a patient on a hold, you have to have resources to take the patient off the hold and send them to treatment. So the original implementation date of this was January 1st, 2025. And I believe that 56 out of 58 counties deferred their implementation. So if you're saying, Elizabeth, that's almost all the counties that chose to wait to implement this, accurate. That is true. They all, almost everyone deferred implementation of this. And the reason is that, as you all know, as navigators, creating new treatment beds, creating new resources in communities to accommodate a higher level of Patients who are demonstrating co-occurring mental health and substance use disorder to a level that they have to have a 5150 hold placed on them is really hard. And this is California. We can't even build a nice mixed-use housing complex, let alone building more treatment beds. It's been really challenging on a statewide level to create more infrastructure for treatment. So that is true. And whenever you have a frustrating day at work feeling like you have nowhere to send these patients, it's because there is a shortage of beds and it is very, very challenging to create new beds. That being said, SB 43 soldiers on. The new implementation date is January 1st, 2026. So your hospital and your county has about 9 more months to figure out the plan. So this is a really awesome time for you to be stepping forward as a navigator and offering your services. So I'll share my final bit of wisdom with you on this last slide that I have. Excellent. So something you can do is similar to while you're thinking about billing, make sure that everybody working at your hospital knows that when these patients get identified as potentially being held under SB 43, that they should be calling you, the navigator, that you are such an important piece of this puzzle to help patients get into treatment. And then, I think there are definitely people working at hospitals who I've talked to who are feeling quite beleaguered by the need to improve access to treatment to respond to SB 43. I bet they would love your partnership. So I know sometimes it can be a little bit intimidating or sometimes take a while to get a meeting with somebody in your hospital C-suite or your operations director or whoever is looking into this care expansion, but they would love your partnership. So if you aren't already tracking what your hospital is doing to respond to SB 43, say, hi, I'm the navigator. These are the types of patients that I work with. I understand the gaps that exist in our community, and I'd like to help make sure we're ready for this volume increase that is anticipated under SB 43. I think that would be really, really welcomed by your hospital leadership. So that was about 2 graduate school semesters of complicated policy content in about 30 minutes. So I would love to take your questions, and I really just want to encourage you to lean into talking to your policymakers. They want to know the actual needs of patients in their communities. Policymakers know that the needs of patients in Oakland are very, very different than the needs of patients being treated at Lake Arrowhead local hospitals. So they really want to know what is actually happening in their district, what are patients experiencing, and what do you need in terms of funding or policy from the state to do your job better and get CHW certified. So what questions can I answer?
Well, Elizabeth, while we're waiting to see if anybody has questions, I know you guys have questions, so please, please, we have the expert here, and I know this is a hot topic with just Medi-Cal cuts coming soon and other things. What is somebody, just as a community member in your own local city, what can you do? Just very simple things.
Yeah, so very, very simple things as a community member, not as a navigator. So same thing. I think a lot of the tips for navigators apply for community members. So you can call your policymaker and advocate for an issue pretty much anytime you want. And sometimes I think you might feel like you need a script or there needs to be some kind of gatekeeping around the messages that you're sending. But you can, as a local community member, and this also might, like, if you do happen to live and work in different districts, this might be an interesting way to compare and contrast how two different members of the legislature respond to you. So I live in Oakland behind the Grand Lake Theater. Unfortunately, there is just a tremendous amount of small crime in my neighborhood, lots of retail thefts, lots of broken windows. So if I had the opportunity, if I was going to call Mia Bonta, who's my member of the assembly today, I would love to talk to her about MAT. but I also know that she knows about the Highland Bridge Clinic and it's a state model, and maybe, maybe my time is best saying, I pay property taxes. I'm a homeowner. I live in this community. I care a lot about it. I work for a couple of women of color owned local businesses, but I'm just really concerned that the students who come to the studios that I teach at are scared to park their cars because they're scared that their windows are going to get broken. So what are you thinking about in terms of state response? So that's an example of like how I might reach out to my member of the assembly as a community member, not as a representative of California Bridge.
Yeah, thank you, because I think that may be the first step. I know navigators, this may be new to you. So we want to make sure that you feel comfortable. And if you've never been to a town hall or city, town meeting, attend. That's something
Yeah.
simple. Just see
Yes.
how it goes. We do have a question about the CHW, and they work for Kaiser. Amber, if you want to, I can reach out to you specifically. Kaiser is a system, so definitely they have their own system programs. So I can reach out to you about that billing option.
Yeah.
And
And
then go ahead.
Sherry, correct me if I'm wrong, but even if individual hospitals have not quite done all their readiness to bill for CHW or health systems, folks should still get certified. Yeah.
Absolutely,
Yeah.
Elizabeth, because as professional development, and it's something that you have in your hand, you could put on your resume. You've met all the core competencies, and it's something
Yep.
needed. If your hospital, even if they're not interested in doing it now, it's something that you already have in your pocket. So we love to have things that just pull out and say, yes, I'm certified. That's very impressive.
Absolutely. And the navigator role has been made very famous by California Bridge, but it is a role that we invented. We made it up, and we're very proud of that. And I mean, the lives that have been saved by the navigators are, just more, just higher volumes than we even know that we've been able to track. But community health worker and promotorists have been staples of our healthcare system for 50 years. So it also might be a way to have to do a little bit less explaining about, what your role is and what your skill set is and what your work is. Because many, many people know and appreciate a navigator, but pretty much everybody knows and appreciates a community health worker.
Absolutely. And there's a question from Tamara. She's at a loss of what CH billing actually looks like. Well, you came
Yeah,
to the right place. We have so much stuff to offer.
absolutely.
So
So,
just contact me or Elizabeth, and we definitely can help you out, or mentors@cabridge.org. We would love to talk to you about CHW billing. So we are here and available. Amy asks, is this session recorded? Yes.
yes.
Our wonderful comms team, Aiden, is behind the scenes, and he is taking care of that for us. So thank you, Aiden. And Henry, he got that injectables question for Stanislav.
Yeah. I'll take a look at my Henry, if you want to reach out to me, I'll take a look at my list of folks working on injectables because I think we'll be able to find a place that's willing to forge ahead with injectables. We understand it's a big lift for pharmacies, so we're working on having better guidance. Yeah.
Okay, Tamara asks, is
Um,
it useful to get certified for CHW if you have a SUD counselor certification? So for Medi-Cal in a hospital, you must have CHW certification to bill. That is the requirement. So if your hospital is interested, they don't even have to do it now, maybe in the future. That is something you would definitely want to pursue. So this is specifically for Medi-Cal billing in the hospital as a navigator in the emergency room. Hope that answered your question. I have been pulled away a few times. Will this be available? Yes, we are recording. All right. Anything
what other
else?
questions?
Yeah, come on, you guys. Anything else?
Is anyone excited to reach out to their policymakers? Is anybody excited to do this? Tanya, you can call Weaver Pearson. She's a doc. She wants to hear from you.
Absolutely. So I think that's the challenge, Elizabeth, to challenge this group is, if you don't want to do it as a navigator, we understand. but just call as a community member. What are you interested in? What's really funny is I know I have people come to the door during election periods, right? They come to the door and they ask. And, one time my husband, it was real funny we have a neighbor and she was a county supervisor. So she came by asking and he was, here I thought he was not paying attention. He's like, "Oh, I have a list for you. We have a light bulb that's out." I mean, these were things on our street. And so, building that relationship, we didn't even know we had an elected official on our street and we became great friends. So you just don't know reaching out what contacts you're going to make from that. And somebody may not even know what mat, low barrier mat is,
Yeah.
and it's a solution. So it can just come
Yeah.
up in conversation. So I know it's your comfort zone, you guys. I know it's not comfortable, but challenge yourself at least, to attend a town hall meeting. And if you have any type of election, vote. That's
Yes.
the
Always vote.
main thing
Always
to
vote.
do.
Yes.
Lots of people do not vote, and that does affect what goes on and the results. Um,
Yeah.
and Tanya asks, interesting that Medi-Cal billing accepts CHW, but does not recognize SUD certification. Tanya, it's for the setting. SUD is acknowledged and recognized, but it's for the specific setting of where you work. So, I'm not an expert in the SUD treatment center world, but I do know uh, as a healthcare worker, it is only for us to bill in the hospital. So that's the difference. And it may be different programs do recognize different certifications, but this is specifically for that Medi-Cal code. So I hope that clarifies because we want to recognize anybody who has a certification.
Yeah.
You are above and beyond. So, make sure you're proud of that and let them know. All
Yeah,
right.
I really want to emphasize what Sherry's saying just about so my experience has been that most of the policymakers, staff that I've met with have heard of medication for addiction treatment. They've maybe read an article in the newspaper about it generally working. That's it. They really don't know a lot about the ins and outs. And same thing with harm reduction tools like naloxone distribution. So that can be a great place to start. And I will share with you that when we passed our bill last year, we had been kind of leaning on how we were in 85% of hospitals, and our impact numbers showed that Navigators had met with over 500,000 patients, and we'd tracked 125,000 buprenorphine starts. We were leaning on like our big numbers. And it actually ended up being our success with naloxone distribution that got us the yes that we needed to pass that bill. We weren't even really thinking about that. We were kind of like, oh, of course, like this is so important and we encourage everybody to do it, but it's kind of not our main thing, right? I mean, we're not the ones who send the naloxone. We just encourage people to support the application. And then when we actually ended up sharing with some stakeholders that we had encouraged 216 hospitals to order take-home naloxone and deliver it from the ED, and that was a complete game changer for us. So you really never know. It can be a little bit tricky to know exactly what part of the work a policymaker staff person is going to be interested in. So that's why you just have to get used to bragging. It's really, I know it might seem kind of like, I don't know where to start. Like whatever you're proud of about your program might be a total game changer for that person who's looking to learn about services in their community. So,
Well, I thank you so much, Elizabeth.
yeah, it was
This is
fun.
great. And, this is only a small portion. We could probably go into lots of other things, you guys, and hopefully we can have Elizabeth to talk about the topics that, in policy that are important to you. Elizabeth, I'd love to have you back. And I thank you so much for all your support of our Navigator program. I am going to
My pleasure.
I'm going to turn it
Yeah.
over now to Latoya. She's going to wrap things up here.
All right. We got some really great information today. And it's time to test some of that knowledge. We're not going to go through all of these, but just a couple of them. If you can put your answer in the chat to test some of the information you've retained, which is really great and super beneficial for you all. I'll start with the first one. So identifying your local and state legislators is important. Is that true or false? Feel free to, yep, enter in the chat. All right, thank you. Yes, that is true. Absolutely. It is very important to identify your local legislators and your state legislators. I'm gonna jump down to number 4. So SB 43 does not expand the definition of grave disability to include substance use disorder. Is that true or false? All right, you guys are on it for sure. That is false. So we just learned that it does expand the definition, and you have some great action items to start getting involved in that. So thank you for participating in some of the knowledge check. You can go through the rest of these questions to test your knowledge when you get the post-event email. And so you know, and if you don't know, if you're new to us, we have a plethora of resources available for you on our website. There's something there for pretty much all disciplines. We have patient-facing resources, we have navigator resources, clinician provider resources, all sorts of things available on our website, in addition to our other programs that we are part of. So visit. You can take your phone out and screenshot this QR code, and you will get a lot of that information in the chat and in your post-event email as well. So one of the great things that we also offer is our CA Bridge Academy, where you can earn additional CEs for our providers, for our other clinicians. They can earn CMEs, nurses as well. You can print our flyer and pass it out. The great thing is that everything we offer on our CA Bridge Academy is entirely free. And because it's asynchronous, people who are super busy can, let it play and listen to it kind of in the background and still absorb and soak in that information, which is really great. If you have any other questions or want to engage with us more, we highly encourage you to contact us at mentors@cabridge.org. We usually are very responsive and have a quick turnaround. Typically, I would say within an hour, 2, usually at the most. So definitely get in contact with us. We love hearing from you. These are our Navigator mentor team. So myself, Tommy, and Chaya. We love helping and engaging with you all and answering any of the questions you have. We're here to support those of you that are doing this really important and critical work to help patients access care. And we invite you to join us. We have social media accounts we're on LinkedIn, Instagram, Facebook. It's now called X, but used to be Twitter. But yeah, find us and engage with us. We post lots of great things on there. And our wonderful, brilliant program director, Sherry Cisneros, is her contact information is here. Feel free to reach out again, and thank you so much, everyone, for joining us. We appreciate your time here. And as a final reminder, today's webinar does satisfy the CEU requirement for the core competencies for CHW certification renewal. So if you want to share this to other CHWs, we highly encourage you to do so. And again, check out our CA Bridge Academy. And that's all I got. Have a great day.